Yeah, you're welcome. You're welcome. You're welcome. You're welcome. You're welcome. You are welcome. You are welcome. We actually going live today on Facebook and on YouTube, and this recording is going to stay. So my name is Dr. Njumiso Chuma from Best Health Solutions. So as you know, we're passionate about community research initiative. We want to make it a point that we go out there and we come up with tailored programs. We come up with tailored initiatives that drive change in our local organization. So we want to make it a point that as we craft our programs, as we design any of our programs, we come up with programs that are tailored to our settings. We come up with programs that are going to drive change, realize change within our communities. We want to make it a point that whatever program that we come up with, be it it's HIV programming, it's TB programming, it's STI, it's NCD programming, all those different kinds of programs that we come up with, they need to be tailored to the communities that we are working in. They need to be tailored and targeted at those particular communities so that we can drive change. Otherwise, if we come up with programs and they don't meet the needs of the people within the community, there is no way that they're going to drive change in those particular communities. So for today, we are going to be talking about enhancing program design through community-led data collection. So one of the key things around this particular topic is that we want to enhance the manner in which programs get to be designed. But how we are going to do it, we're not going to be using research from other countries. We're not going to be using literature review. We are not going to be, going Googling of what is happening in that particular community, but we would use community-led data collection because we want to drive localized change within our communities. We want to come to a point where from the work that we are doing in our communities, we drive localized change. We come about initiatives that would actually drive change within our community. So, like I said, we are live and we are actually live on YouTube and Facebook. Want to make sure that as many people out there, they get to know about what could potentially be done differently. How can we ensure that we are reaching out to as many people in our communities? How can we ensure that the great work that is currently being done gets to be tailored to the needs of the communities? How can we ensure that on a day-to-day basis, as we work on our programs, those initiatives that we are coming up with, they are actually targeted and tailored to the communities that we are. So it is key and critical that as community-based organizations, we come up with interventions. As civil society organizations, we come up with interventions that are largely targeted at the ideal target communities and also the ideal people that we want to make sure that they receive that particular messaging on a day-to-day basis. So that is the key, and it is the centerpiece of today's presentation. It is the centerpiece of the work that we're going to be talking to today. We want to make it a point that we reach out to the relevant people. So this is coming from a background that says that as of around October 2024, South Africa is actually not reaching its all its goals when it comes to the N8 95, 95, 95. For those that are in the health space, you would know about that. We're doing quite well on the first 95, where we have hit 96%. But when it comes to the second 95, we actually at 79%. And then, of course, the last one, we are at 94%. So it means that there's a lot of work that needs to be done in us reaching our 95, 95, 95. And I must acknowledge the fact that there's a lot of great work that has already been done. Because for us to be at 70-something percent when we're heading towards, it's not that bad. But as a country, we would want to always be on top of things, to be 100% whenever we are doing any intervention. And also, if we are losing one person, that person is a key and a critical family member that we need to provide support to. So then there is a shift in terms of programming, and an emphasis in terms of programming to see that for us to be in a position to implement these kinds of programs, what could be done differently? How can we go out there and drive change within our communities? And of course, the centerpiece of this sits with communities. Those are the centerpiece of this work. And who else is better positioned to access these particular communities? It's actually civil society organization, the CSF, Civil Society Forum, the different sectors within the civil society. And the good part about it is that already there are studies that are underway that have been conducted by the research sector or led by the research sector, working collaboratively with different sectors. And apart from that, these studies are actually designed, developed, and implemented by civil society organizations, by the sector leaders themselves, who are rolling their sleeves and saying that, let's get this work done. Let's gather the information. Let's collect the data from the communities. Let's be an active participant in this particular initiative. And at this particular stage, they're out there in the field. I know some of them today, they were holding focus group discussions to engage with the people in the communities, to engage with people that are playing some sports, to engage with faith-based organizations or churches. So they were sitting with them to engage around some of these particular subjects, so that each and everyone is not left behind in this particular in this particular process, because it is key and critical that in integrating research into community programming, we are led by the communities themselves. Because at the end of the day, we want to integrate community insights into actual program design. We want a situation whereby when we come up with interventions, when we come up with programs, when we come up with these tailored interventions, they are actually so specific. And the messaging that we come up with is actually tailored to these particular communities that we work with. So, in integrating community insights into our program design, one of the key things is around engaging community members in decision making. So, like I said, the starting point is around ensuring that everyone is sensitized about the initiatives that we're coming up with. Be it want to increase PrEP uptake in the communities. We need to engage with the traditional healers. We need to engage with the traditional leaders. We need to engage with the sex work sector. We need to engage with various stakeholders that are in the community and say, how best do we pitch this idea of PrEP in a culturally and socially accepted manner? How best do we talk about it to our youth, to our adolescent girls and adolescent boys? How do we talk about PrEP in a culturally and socially acceptable manner? Because some of these things, we might design them and think that they are beautiful programs and all of that. But if they are not crafted in such a manner that they are acceptable from the perspective of the community members, there is no way that the community members are going to bite on it. So, key and critical is to start off this process by engaging with the community members in decision making. So, we need to involve the various stakeholders in identifying the health priorities and designing the interventions. And this can be done as simple as bringing them together. So, you find that the youth sector can sit with the youth and say, how best do we craft this particular intervention? Or, for example, the men has come up with various interesting interventions that are out there. And from those engagements that men are having with other men, they are likely to gather key and critical information in terms of how best to come up with interventions that ensure that they reach out to 1 million men in the communities. This could be boys, or it could be men that are out there in the communities. From those interventions that they come up with, they can craft a targeted messaging so that they are in a position, to share that messaging, around how best they can ensure that the men, they go to these health facilities, they get to be tested, or services go to places where men can be found. And that is the key and the critical step in terms of how our programs get to be crafted. The starting point, the primary starting point, is to involve the local stakeholders in setting health priorities. For them to understand, for me to unpack this further, is to say, how do we get to engage men to set health priorities? Is to say, as a man, or as a woman, or as a young person, what are your health priorities? What do you think that what are the implications that could have, let's say, if you had TB? How can that affect you at a personal level? What are some of the emotions associated with that? And then we get to address some of those particular aspects, or to understand some of those particular aspects, so that we can come up with programs that are tailored and targeted to address those emotional, emotive aspects that are associated with people being taken to the health facilities. Because if we don't address those particular aspects, we are likely not to appeal to individuals at a personal level. We need to understand exactly what are their pain points. What are the things that when they get to hear about a health facility that make them feel like, no, 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 me, I'm not going there. I would rather be put on a wheelbarrow than for me to go there to that particular health facility. We need to get to involve these people and engage with them, talk to them to say, what, this is the initiative that we're coming up with. And I'm a man, I'm part of the men's sector, or I'm a lady, I'm part of the women's sector. As a society organization, we get there, we talk to them, and we say, but why is it happening in this particular man? Why is this happening in this particular fashion? How best can we come up with interventions? In some cases, you might find that even women from the women's sector, they can assist us in reaching out to these men. Because as you know that there is generally low uptake of health services among men. When it comes to these particular targets, specifically among men, you find ones that the numbers are a little bit lower as compared to women that are accessing these services. And also as compared to children, in some cases, children numbers are always higher because they get to be taken there by women or their mothers. So it at least assists the children, but they are men, and then they are children, and then they are women. Then we can begin to understand this problem from a perspective of women to say that why is it that men are not coming to health facilities? And how do you think we can assist you to pitch the idea to men? Because the father says, if women are already coming to the health facilities, and women have got partners that are men, and then we have got a chance of reaching out to these men through the women or through the children. If the children are already winning in terms of going to the facilities, we have a chance of reaching out to these men through, the women or the children. So we need to come up with tailored interventions so that we increase the capacity of women to be in a position to disseminate that information to men. You might discover that we've been talking some of the programs talking men to men, but actually we're missing the point that we should be talking to their partners to assist us in reaching out to men. So are some of the lines of thinking that we should potentially be talking to. We should be thinking about saying that, couldn't there be a possibility that maybe women are actually the best vehicle through which this information is supposed to be disseminated to men? It is true that in some cases we need to come up with tailored messaging that goes directly to the men. But in some cases, you might find that actually for us to have a quick win or to get better results, we should potentially be reaching out through women. And these are some of the lines of thinking that we need to be talking to. We need to be thinking around that to say, how best do we engage our community members? How best do we engage these decision makers? Because men are the decision maker at a household level. So how best do we engage them? In some cases, women are actually the decision maker at a household level. How best do we engage these particular decision makers that we find at the household level? At the community level, we've got the chiefs, we've got the ward councillors, we've got all of these kinds of influential people, the influencers that are at a local level. All of those people, they play a key and a critical role. In some cases, it's actually these young boys who are in schools. There are certain people that play a key and a critical role. They could be maybe the prefects there, or some of the SRC people, student executive council people. All of those people, they could play a key role. But different stakeholders need to ensure that they reach out to these particular stakeholders in the communities that we are actually serving. And we need to, as civil society organization, to come up with strategies through which we're reaching out to them. So that when we reach out to them, we are not going there with a foregone conclusion that says Men are not going to health facilities because there are female nurses in these health facilities. Men are not going to health facilities because there is this kind of a problem in the health facility. But we are going there to find out exactly what is the root cause of these men not seeking health services. What is the root cause of this gap that exists within children, of children not being taken to health facilities or missing from being initiated on treatment? What exactly is driving this particular challenge? So we get to engage with them, we get to talk to them, we get to get an in-depth understanding in terms of what exactly is driving that particular problem, how exactly can that be minimized. And that can easily be done through having a dialogue, through having focus group discussions, through having key informant interviews with some of these men, through having one-on-one interviews with some of these men, and we can find these men in various areas of congregation. This could be the churches. You would find them in bars. You would find them in brothels. You would find them in strip clubs. You would find them, at their workplaces. In some cases, you find them at home. So in all of these places, we are bound to bump on men. We find them at the train station, going to work. We could do some of these interviews even in taxis, whereby we started discussion in a taxi around how can we do this kind of work. And then from there, people get to engage. Some of us were traveling for 45 minutes, going to work in a taxi, but that's a grand opportunity whereby you can engage people in a taxi. They get to be involved in that discussion, coming from work, going back, going back home. It's a great opportunity that as civil society organizations, we need to be organically collecting data. Let's not wait for us to be having a focused discussion in a community hall. Let's actually engage these people in their areas of comfort, in their areas as they are enjoying a sporting event, as they are enjoying their trip, as they are sitting there. You seek consent, you talk to them and say, hey, I would want to talk to you about this particular subject. What do you think? We begin to gather that kind of information so that we can drive change in our communities. But over and above that, we could potentially be looking at using social media as a means through which we're gathering information. Because one of the key things is that everyone nowadays is on social media. It is true that some people, they don't have these phones that have got WhatsApp and they're on TikTok and Twitter and all of that kind. But it's not true that men are not. There are men that are there, men that are not there. But let's reach out to those that we can reach out through social media. Those that would have missed through social media, we can do them through door-to-door campaigns. So let's come up with interventions, messages that is targeted. Men can be loaded on Facebook, can be loaded on Twitter, Instagram, all the different kinds of social media platforms. Let's make it a point that we come up with messaging that can be channeled through that. And I must say that the civil society forum sectors, they are presently in the field trying to gather some of that information, because that information is going to end up influencing the strategic communication that has to be done by civil society forum, by the SANAC civil society forum, in terms of how information can be communicated on a day-to-day basis, so as to sensitize our communities. As long as it's tailored messaging, are bound to drive change. Because the truth of the matter is that people out there in communities, they are already educated. They've already been informed by these things. But there is something that is missing. There is a gap in terms of them moving from where they are to actually seeking those particular services. And for us to jump that particular gap, we need to understand what are some of those pain points. What are some of those aspects that make them not to be willing to go to certain facilities? What are some of those things that are from a facility side that would make them not to be willing to go to the facility? And from a facility perspective, also, we need to understand that there are a lot of people that are going to these facilities. How else can we, reduce the load of people that are going there, or get them to come there in a much more structured manner? But we need to discuss all of those aspects with health facilities so that we get an in-depth understanding to say that as we are driving people from the communities to the health facilities, or we are driving health messaging from, or health services from the health facility to the communities to ensure that there is increased uptake of health services. What can we do differently? How else can we ensure that there is uptake of services and people are retained care? And all that needs to be done by integrating implementation science, integrating research, integrating community insights into our work. And another thing that is actually key is around the incorporation of local knowledge. You'll find that among certain groupings of men, there are certain cultural and social practices that they tend to undertake. So we need to take that into context when we're engaging these men, so that we don't get there and we come up with interventions, we come up with programs, or we pitch ideas that are not acceptable to those particular scope groupings. All I'm saying is, as we are crafting our programs, let's keep it in mind that one headline, one message cannot cover all men. It cannot cover all women. It cannot cover all transgender people. We need to think about the fact that how do we come up with messaging that is tailored? That knowledge, when sent to someone, that person does not block that knowledge, but they consume that knowledge, they consume that information, and they're encouraged to actually do something about that information. Because the part whereby we share information with people and then they don't do anything, it's of no use for us to share that information. There's the need for us to have lots of tailored messaging and targeted messaging, whereby we understand the different contexts that people, the different situations that people go through, the different aspects that tend to affect people in the communities, and then we come up with crafted and targeted messaging so that we make sure that we drive change. Because at the end of the day, we want to drive change within our community. So there's an aspect where we all be doing all of this so as to enhance our program relevance and acceptance at a community level. We want to make it a point that as we design our programs, they stay relevant and acceptable, so that at the end of the day, we are coming up with these interventions. We get to know what works, what is likely to work if crafted properly, and what doesn't work. And when we categorize our programs in that particular fashion, we come to a point where we say, how best do we improve and document and disseminate what works in our communities? And how best do we ensure that it is presented in a socially and culturally acceptable manner? How best do we ensure that some of this work ends up influencing policy, ends up influencing how work gets to be crafted going forward? Because if we are to come up with lots of policies, with lots of process maps and all that, you would find that we might be following the processes, we might be disseminating the information, but if it is not targeted and tailored to that particular community, there is no way that we're going to be successful. So that is the key and the critical stage when it comes to the integration of community insights into the current programming. We need to make a point that we engage the community. We leverage local knowledge around the work that we are doing, so as to ensure that the work that we are doing is tailored, specific to the communities that we are serving. And then the other part is that, like I said, as we speak right now, civil society organizations, some of the sectors, they're out there collecting data in the field. And they are collecting this data in the field. They are bound to meet some of the challenges, in these particular communities. In some cases, you might find that, the community members will feel like, but why are we participating in particular surveys? What are some of the benefits of participating in this? And I must say that as civil society organizations, one of the reasons why you will find that we get men to go and engage with men is because men will be having a lived experiences of themselves being men. And they will be in a position to go and pitch to another fellow man to say, hey, you know what? This is what is happening in the communities. Some of us have been going to the health facilities. Some of us, these are the challenges that we're currently facing. Some of us, this is how we have not been supportive, or we've been supportive of our partners, but we could do things differently. We could maybe do this and this in terms of ensuring that there is increased uptake of health services amongst men. So maybe we're doing this study or this work so as to just understand, to pick the brains of men, because we don't want to go and pick the brains of women in terms of what men think. That's why we're coming to you as the men to men. And then men will then understand, say, okay, it's fine. Now I'm going to give you 5 minutes of my time so that we can engage upon this. And then there is value that comes with briefing your key stakeholders. There is value that comes with briefing the respondents, because they need to be briefed in detail in terms of why are we undertaking these initiatives. You know, what are the benefits? It's a benefit to the community. It's the benefit to the broader society. What are some of the benefits of undertaking these particular initiatives? You know, and what are some of the things that they are going to benefit as a community? They are going to build a brighter future. They are going to have an HIV-free generation. They are going to have all of those cheese that they talk to. So these are some of the aspects that we need to talk to when we're engaging men in the communities, when we're engaging with people in the communities. Because as civil society organizations will be going out there, we'll be engaging with people in the communities. And we're likely to face these kinds of barriers. Why want me to participate in this kind of a study? And it is key and critical for us in civil society organizations to be in a position to pitch this idea and talk to them and engage with them and get them to see the value, because the ideas, they are actually the centerpiece of us reaching out to as many people in our communities. So in some cases, you will find that there could be aspects to do with ease of access of these particular individuals. And they might not be willing to come to face-to-face engagements that we'll be holding. Maybe we want to do a focus group discussion or a key format interviews. So the other way of doing it is that to get them to be involved in these discussions virtually, where you can have a WhatsApp-based call with them. You can decide to say, I'm going to have a call with you on Zoom. Which time would best suit you? I'm going to come and see you over the weekend. So we make it a point that we make it comfortable to the respondent, to the people that we are engaging with in the communities. And we become flexible on our side to say, we are willing to take it a step further. We are willing to come and visit you at your home. Some people are not comfortable with being interviewed at their homes. Say, on which day will you be available? I can meet with you somewhere at the park, somewhere in the streets, or before you go and drink, or when you come back from work, I'll be by this stop, and then we can engage, we can discuss this particular subject. So there must be that flexibility that sits among civil society organizations, among CSF leaders, as they are rolling their sleeves, going into the communities. I know they are going to ensure that they reach out to as many men out there. Some of them, they've even gone to an extent of scheduling virtual sessions where they'll be on Zoom, on Teams, to ensure that they engage with men, they engage with mothers, to try and come up with means through which they can ensure that children are reached out to, men are reached out to, but also some of the mothers have been left behind. How can we best reach out some of the women that are out there? How can you reach out to the LGBTQI community? How can you reach out to the sex workers? How can you reach out to the PWID who are out there in the communities? So all of those interventions, they're actually tailored interventions that are part of the broader scope work that needs to be done this year. And we are looking at betterment for tomorrow. And it's one of the key and critical things that we want to make it a point that we've got betterment for tomorrow, where we drive change and men take a leading role, not only at a household level, but also in the broader communities. We're not only at a workplace level, but also in the broader communities, at a household level. Men, they take a leading role in driving change within the communities that we are serving. And of course, when this data gets to be collected, there is a need to ensure that the data that we collect is of good quality. So key around this, to make it a point that, so in the process of doing this research work in the communities, you will find that we are going to be conducting interviews as we go, maybe door to door, but making a point that before you collect the data, you brief your respondent, you brief the men that you're interviewing, you brief the youth. I know the faith-based sector is going to be reaching out to youth that are out there, and they've been engaging with some of the area faith leaders to say that they would want to conduct interviews. So they need to do some briefing sessions. I know the human rights sector, the law and human rights sector is also going to be reaching out to some people that are implementing access to justice program, people that are in the legal space, in the human rights space, some paralegals, so that they engage around how best do we improve health services. And also the sports, arts and culture sector is also going to be going to the sports ground. This weekend they're actually busy at the sports grounds, gathering information in terms of what do young people think, how best can they use different communication methodologies so as to increase sensitization of communities, gathering of data at a community level. So all of those are the different kinds of channels that are being used by the different stakeholders. They need to all come together into one place. And lastly, this is going to be qualitative data. Qualitative data is people's ideas, what do they think, their thoughts about certain things. And one of the key things when it comes to qualitative data is that we need to make it a point that we record that data. And when we record data, it must be kept safe and secure. So we need to make it a point that as we collect qualitative data, where we will need recordings, this will be the voice recorders, where you go out there and get the voice recorders, and then we use the voice recorder. And one easy way around it is that when you're conducting an interview, say this is a voice recorder, you're recording, you say something, and then from there, you want the other person to respond, you can use it like as a microphone, whereby the other person then responds to that. When you are done responding, you then come back and then you pause your question. So that way it even enhances sound quality and it gets you not to talk over each other. And let's say it's a group of 2 or 3 people, you might then, put it in the middle or allow them to, move it from one side, but just make a point that it is recording at that particular moment. And then as soon as you arrive home or you arrive to your office, you then take that recording, you put it in a safe and secure place. This could be on the drive or it could be in your computer, just to make sure that you get to draft some notes around it, say, oh yeah, I had a session with 3 people, and this was their age groups, and this was the location of this, so that you don't forget where your study was undertaken. Otherwise, you conduct all these interviews, and then from there you find yourself sitting there with data that you can't map and see where the data is coming from. And of course, you share that with your core investigator so that they can put all of your data together. So it is key that as we are collecting this data, it is data of good quality. You have got your discussion guide, you have got your interview guide. Follow your interview guide. But key also when you are following your interview guide is that as questions are coming, as you are posing those particular questions, listen attentively and probe appropriately. So you need to listen attentively and you probe. So probing basically it means that you will be asking questions. Why? Why? Why is it like that? How can it be done differently? What are some of the interventions that could be done? But why is it happening in that particular fashion? Based on what you have just said, what else could be done? Why is that it's happening like this? It is very key and critical when it comes to the collection of qualitative data, because the richness of qualitative data that we collect from the communities is largely based on the why question and how can we do it differently? What are some of the things that could be done? And those are the things that we really need. That is the core and the main reason why we're doing qualitative data collection. We need to collect as much information as is possible from our communities to make it a point that there is an in-depth understanding in terms of what is happening and how can we do things differently. We want to hear people's thoughts. We want to hear their suggestions as men. We want them to talk to us. We want them to say the most relevant things. We want them to say things that we wouldn't have thought about. We want them to unpack all the aspects. We want them to unpack the emotions, the aspects that relate to their fears around any of the aspects that relate to the whole value chain from home to work to the health facility. That is their major fear around that particular. So that when they unpack all of those aspects, we are in a position to then look at the data. We then analyze that data. We co-create programs. We co-create health messaging that is targeted to the community members. So one of the key things that is very key as the field teams, as civil society sectors, they are going out there and collecting data is to be inquisitive, is to go out there and ask questions, is to go out there and have that mindset to say, why? How come? How can it be done differently? What are some of the interventions that could be done? So those are some of the aspects that we need to talk to as civil society organizations. As we are busy out there in the field doing exceptional work, gathering the information, please let's come back with gold. Let's mine the data from the communities. Let's extract the data from the communities. Let's get to hear their brains. Let's get to hear exactly what they think. And one of the key things is that when we're doing these interviews, they need to be conducted in local language so that we allow people to speak in Totital. They begin to speak, in Sotho, in Zulu, in all the different kinds of languages. If they have to mix English and other, they get to mix it as long as we're in a position to understand, as long as they're in a position to articulate themselves in much more detail around what is their thinking. That way, we will derive value, and our programming going forward is going to be much more targeted and much more informed. And even the health communications team are going to derive value from the information that we are going to be gathering, so that at the end of the day, we've got better men for tomorrow. At the end of the day, we drive change, not just by saying, yeah, men should do this, men should do this, men. We need to have that listening ear so that we are in a position to actually drive change within our communities. Like I said, key crafting of these whole studies. We craft the study jointly with the civil society sectors. When we're going to collect the data, as we go into these communities to collect the data, we need to have that mentality of the why, how, what could be done differently, getting an in-depth understanding. When that data has been collected, the next phase is actually the co-creation of the solution, where we're coming up with tailored solutions to our communities so that we can drive change in our localities. And I'll say that all of these aspects, they are key to the practical implementation of the program. And at this particular stage, I would like to say that going forward, let's all work together. Let's all craft initiatives that will be targeted in our communities, that would drive change in our communities. Because if we work jointly with the communities, we are bound to drive change within our locality. And let's all come together and drive change in our communities through gathering insights from the communities. Let's make time to reach out to the sex workers, to the people using drugs, to the LGBTQI, to children, to women, to men, to the traditional leaders, to the traditional healers. All of these people have got a voice in the space that we are working in. Apart from other groupings of people, let's reach out to these through our different sectors and get to understand what are their thoughts, what are their pain points. We get to gather data from them. Today, I'm talking about largely qualitative data. Let's gather qualitative data from them so that this qualitative data, rich as it comes, is going to assist us in integrating community insights into programs. Because without qualitative data, as civil society organizations, we won't have that power that we are supposed to be having. But if we've got an in-depth understanding of the numbers that we've always been collecting, numbers, yes, they are going up, but we need to go back and say qualitatively, what are some of the pain points? We get an in-depth understanding of saying, okay, based on what is currently happening in the community, how can work be done differently? How can we do business differently? What are some of the innovative practices that we could potentially do in the communities? So, going forward, let's all work together. Going forward, let's all drive change in our communities. Let's all work together with different sectors and build the communities a brighter future that we want to have. And thanks a lot for making time to attend to this session. We will keep on hosting multiple sessions multiple webinars, lives, so as to ensure that we keep everyone in the community sensitized in terms of what is currently happening, the changes that are happening from different angles. But for myself, I'm Dr. Ndumiso Chuma from the Best Health Solutions, who's part of the research sector within the SANAC Civil Society. All the best in all your interventions and great work in the community. Yeah.